Immunizations officer.
Okay.
Um, yes, I want to say, I want to talk to them to mute real quick. So အားလုံးဟိုကျေးဇူးပြုပြီးတော့ဟိုအနီပတ်တန်လေးကို mute လုပ်ထားကြပါနော်မလုပ်ရသေးတဲ့လူတွေကျေးဇူးပါ and Rain Daddy too can you please mute thank you that's it
All right, great. Thank you so much for everyone for being here with us tonight and for being able to participate in our webinar series on how to keep kids safe in schools. Before we begin, a couple of things that we need to go over. Please make sure that you are muted. That's really, really important so that everyone gets the opportunity to hear what we have to say. And we're looking forward to hearing from our speakers, and we specifically want to hear from you, our participants. Your questions, ideas, suggestions, and any resources you would like to share. So we want to give everyone an opportunity to ask questions. So please use the chat box, or you can wait until and give me
sorry,
sorry.
excuse
Go
me.
ahead.
Yes. Miss Seema, could you please talk to them too? And then Miss Fahima as well, and Miss Sadia, please. And Miss Ayan too. Could you please let them to like tell them to mute? Thank you.
Miss Sadia.
اوكي السلام عليكم براء ممكن الكل يكتم الصوت
اوكي
الكل يسوي ميوت
Okay, great. Thank you so much, guys. So I'll just go ahead and start from the beginning. Just wanted to thank everyone for being here tonight. And, you know, we want to be able to hear from you. So please use the chat box, or you can wait until the end and just get into the breakout rooms for the Q&A sessions, and you can ask the interpreter some questions as well. The session is being recorded and will be available to participants through our YouTube channel. So to sort of kick things off, I'd like to introduce myself. My name is Suad, and I am a graduate research assistant at the Prevention Research Center at Georgia State University. I'm also a parent to two amazing kids that are at ICS. I have a third grader and a kindergartner as well. And I just wanted to talk to you guys a little bit about what we do. So the PRC is based out of Georgia State University's Clarkston campus and is a CDC funded network that has been addressing health equity within the Clarkston population for a really long time, along with our community partners and organizations as well. So the PRC is part of, I'm sorry, let me go over to the next slide. We are actually part of the Clarkston Equity Coalition. It is a coalition that addresses health inequities and barriers to health for parents and families, and it consists of over 30 plus nonprofit organizations. We've been promoting vaccine events here in Clarkston, and if many of you noticed the Be a Superhero vaccine events that we had at ICS, that was pretty much us, along with CORE that was providing the vaccines. And our overall aim right now is to provide wraparound health services to schools. So without further ado, I'd like to go ahead and introduce you guys to the lovely Dr. Hogai Nazari. Dr. Nazari, if you want to just say a little bit about yourself and some of the amazing work you've been doing in the community as well.
Great. Well, good evening, everybody, and thank you for having me tonight. I am so excited by how many people have logged on. This is wonderful. I think I see there are like 40 people that have logged on, and this is a sign to me that there are a lot of parents out there who really want to have healthy kids and would like to get more information about how to keep your kids healthy. I'm the mother of two boys. Both of them are now out of high school, mashallah. One is at University of Georgia, one's at Georgia State, and even as a doctor, it was hard knowing what to do as they were growing up. There was always challenges, always questions I had. It's very hard to raise children in this society, I think. It's much easier in some ways in other countries where things are a little simpler. Here, there's just a lot of challenges. And so if there's anything we can do tonight to help answer or explain some things, that would be great. I'm from Afghanistan originally. That's where I was born. I came to the United States when I was 5. My parents came here and I grew up here. I went to medical school here. And, but I speak, Dari with my parents, and, I feel very close to my culture. And I hope that I can answer some questions or explain some things tonight.
Perfect. Thank you so much. We are so glad that you're able to be with us and answer a ton of questions. So one of the first things that we wanted to move on to is just talking about the importance of COVID-19 vaccines. We obviously cannot forget that we are in a pandemic. I know as much as people are just so tired about hearing about COVID and vaccines, it's very much there. People are still getting affected. And just wanted you to just talk about the importance of COVID-19 vaccine and a little bit about this study as well.
Yes, absolutely. So, we live in a different world than what we lived in, 4 years ago, 3 years ago. It's very different today. Our children are under a lot more pressure because they know that we're worried about this virus. A lot of them, depending on their age, had to do schooling kind of remotely for a year, which was so hard and just a disaster in so many ways, all because of this virus. In Islam, we have a saying, we say, trust in God, but tie your camel. And what that means is that you should take the steps you can to protect your family. You trust in God, you trust that, things will work out, but you do what you can to protect and follow the advice of the people who are experts in this field. It's really important that children get vaccinated for COVID, because not only can they get sick, but they could bring that virus home to their parents, their grandparents, if they have a baby in the family. It's not just that they get sick, but they are carrying that virus to other people. And we want to make sure that our kids can live normal lives, that they don't have to stay home again, that they don't have to wear masks all the time. If we want to have that kind of a life that I consider normal, then we have to get vaccinated. That's the deal that we make. That's kind of the arrangement. If you want to be able to do things normally, go to parties, go to activities, go to school events, and also protect the teachers who are around the kids. I think it's really important for kids to get vaccinated. Now, when a child gets COVID, sometimes they get a very mild illness, very, very mild. But what they found in this study that you're looking at is that for the kids who did get sick, the ones that got hospitalized, 90% of them were unvaccinated. So we know that the kids will still get COVID. Getting vaccinated doesn't prevent you from getting COVID, but it protects you from getting severe or very serious COVID. So it protects you from getting so sick that you end up in the hospital or that you end up missing school. And we all know that missing school is not good for our kids. And in this study, you can see that at least 2 of the kids that got, that were 20% of the kids that were hospitalized ended up in the ICU, which is very serious. So we know that vaccinating our kids keeps them healthy. They may still get COVID, but they won't get it as badly as they would otherwise. Next slide. So go ahead. No, please.
No, I was just going to say, we wanted to move on to the bivalent booster. And I know that a lot of people have questions as to, who is eligible to get, to get the booster, and why is it so important compared to the others?
So how many people here, can you raise your hands if your children got the first 2 vaccines? Have your children gotten the vaccines so far? Yeah, good, very good. So what we're saying here is that if we want them to get the bivalent, the new one, they have to have the first 2 and get those done. So not, remember there was another booster after that. They don't have to get that other booster before they can get this, but they have to get the first two. Okay. And basically this newer vaccine is different. It is got a component in it. It's got a part in it that protects against the Omicron variant. So it's more effective. It's stronger. It's better than the earlier ones, because the earlier ones only protected against the early type of virus. So it's very important that kids go ahead and get this bivalent vaccine. I have a lot of patients who say to me, oh, I already got COVID. I don't need to get the vaccine. Guess what? You can get COVID again. I have patients who've had COVID 3 times. And one time they got it at the very beginning before the vaccine. Then they got it once after the vaccine when the Delta variant was there. Then they got the Omicron variant. Why did they get it so many times? Because they started getting more relaxed, right? They started traveling, they started going to gatherings, family weddings, family funerals, because they wanted to participate in things. They weren't wearing a mask all the time. Okay, if you don't want to wear the mask and do all that, you've got to get vaccinated, because that's going to protect you and protect other people. So that's why a lot of people want to just forget about COVID and say, oh, it's over. It's not over. Okay. I still have patients that are missing days at work, missing days at school. Not too many of them are getting admitted to the hospital right now, which is good, right? Because most of them have had at least 2 vaccines. But we have to stay aware and stay careful. If you're not going to walk, it's very hard to get kids to wear their masks all the time. So make sure they get their vaccines.
Yes, I think that was one of the things I was going to say, is that almost everyone isn't wearing a mask now. And I think that's why it's really important to get the booster. And, there's some people that react differently to COVID and have missed a week of work, or even sometimes 2 weeks, and it takes them a while to kind of get back into the swing of things. So it's really important to stay up to date on your COVID-19 vaccines and definitely get the booster. So thank you for mentioning that.
Yeah, one thing on that. So, kids may not get that sick with COVID, right? But if they bring it home and give it to you, I have seen a lot of adult patients who they're grown-ups, they're adults. They have had some serious effects from COVID. I have one patient I take care of who he basically has had to quit his job because he's so tired and he can't focus, he can't concentrate. I have another patient who she still can't breathe well after getting COVID, and she's very young. So, we can't live our lives like alone in our houses. We have to go out, interact with the world, but just protect yourself when you're doing that and get vaccinated.
So we just went ahead and put up the pediatric schedule. And with this, I can just talk a little bit about it. Typically from ages 5 all the way up to even 11, if you've gotten the first and the second dose, usually the first dose you get it, and then you have to wait 3 to 8 weeks or 4 to 8 weeks before getting the second one. And with the bivalent booster, you have to wait at least 2 months. So we just kind of wanted to include that just so you guys can see that visually.
Mm-hmm. And I want to mention, Suad, that with the first 2 vaccines, sometimes people have side effects. They can feel like they have a fever, or they feel like their arm is really sore, or they kind of feel tired. We don't see that as much with the third one. It's not as difficult, or you don't have as much like side effects from it. So that's also a good thing. You're not going to feel like, oh, I can't go to work the next day, or I can't go to school the next day because I had that vaccine. It's really very mild.
Absolutely. And I think it also talks about the same thing. Give me 1 second. I think we just need to meet someone if we can.
And this is, again, where people can really get the good advice and good information from their doctor. So from their family doctor or their pediatrician. A lot of what you read online or you see on TikTok, it may not be true. So always go to the person you trust. Go to your doctor, your pediatrician, your family doctor, your internist. Talk to them. They know you. TikTok doesn't know you. TikTok doesn't care about you. Okay. And your relatives are going to tell you crazy stuff. My relatives tell me crazy stuff all the time. And I try to tell them, look, that my mother, let me tell you a story. Okay. So my mother, this was when the vaccine first came out. I was so excited. I got her an appointment. She's 80 something to get her vaccine at Mercedes-Benz Stadium. I called her. I said, well, John, I got you an appointment. You just have to go. She said, oh, let me call my doctor and ask him if I should get the vaccine. I looked at her. I'm a doctor and I'm her daughter. And she still didn't want to listen to me. I said, Mom, I've been working hard to get you this vaccine. I've been looking online for like hours. I said, you're going to go get the vaccine. So even though she knew that she could trust me, I'm her daughter, she still was like hesitant because she had heard from her cousin something negative. Don't listen to all these people. Okay. Talk to your doctor. All right. And go to the source, somebody who knows about medicine and who knows you. It's okay to have questions. Talk to them about it, ask them questions, show them things you've seen online. But at the end, you've got to trust them.
Absolutely.
So you can mix them, like you can basically, I personally, some of my patients say, oh, I want to mix them because I think it'll work better. I tell them keep it the same if they can. I don't see why you should try to mix them, but if you do mix them, that's okay. It's not a problem. You should get whatever vaccine is available.
So I wanted to go ahead and introduce Cassidy, who is with CORE IRC. Cassidy, do you want to talk a little bit about what CORE does?
Sure, and Faven is here as well, who is
Yes.
also a part of our partnership. So I'll pass it over to her in just a minute. So I wanted to start off. So I work with CORE, Community Organized Relief Effort. We will be providing the vaccines at the upcoming event at ICS. So we are a team that goes out and provides mobile units to different areas, and we provide vaccines in different communities. We provide COVID vaccines all over the country and across the state of Georgia. And in DeKalb, we are partnered with many community-based organizations to provide these vaccines. I want to let everyone know that our vaccines are always, always, always free, 100% free. You do not need insurance. You do not need your ID. So we will accept anyone to come get their vaccine with us. We also accept walk-ups. So you can come without registering before, and we can help you register when you come to one of our sites. So when we're at the school next week, don't worry about registering beforehand. That's okay. And our teams can help support with registration when you get there. And I also wanted to add that our teams speak many, many languages, so we can also help with that registration process and the vaccination process. So we have interpretation for you available if you need it. And with that, I'm going to kick it over to Faven, who is part of our CORE IRC partnership.
Hey everyone, so my name is Faven and I work with the IRC as a community health response coordinator, and we partner with CORE. I was also at CORE prior to this. So a little bit about our vaccine sites. We provide vaccinations for everyone, so anyone that's 5 and older. We also provide the boosters, both pediatric and adult. So 5 and older again, for those people so boosters are for people who've already gotten their first 2 series. And then we also provide vaccination for those immunocompromised, and we provide Pfizer and Moderna at all our sites. And a little bit about the ICS event that's coming up. So we are, it's going to be incentivized. So $100 gift card for each member of the family that gets vaccinated. And we will be available at the end of the webinar to answer any questions that you may have, as well as be available at the site, both me and Cassidy. So if you have any questions, let us know here and on the site. And just a quick reminder, if you have had your first, at least one dose of your vaccination, please be sure to bring your CDC cards. If you can't find it, that's okay. We'll try to find you as long as you have been vaccinated in the state of Georgia.
Thank you so much, Cassidy and Faven. It's good to see you guys always. When you, sorry, let me actually go back because this QR code is to the Facebook page. It's just facebook.com/IRC Atlanta, and the website is updated on a weekly basis. You're going to look for a flyer like this that will have the locations of where they're going to be. I do have to say, I believe every Friday they're at the Clarkston First Baptist Church. So if any of you need to get vaccinated, you can just go there, but definitely get onto their Facebook page to look for this flyer. Okay, so we're moving on to the under 5 vaccines. Now, we will not be offering under 5 vaccines at the ICS event, but we have created a list of places where you can get it done. I do have to say, I mean, it's easier for you to probably just reach out to your pediatrician, and most likely you can get it done there. But if you do need a full list of this, we will provide this to the school. We just wanted to go ahead and include that. If you have kids that are under 5 that need to get vaccinated, we can provide you with resources on where to go. I will kick it back to Dr. Nazari.
Great. That is wonderful that you get $100 gift card for each member of the family. Wow, that's amazing. So I hope people take advantage of that. That is wonderful. So one of the things that right now, getting the COVID vaccine is really important. But what I'm really worried about right now is the flu. So we are seeing a lot of people with the flu, and the flu is not just a cold. The flu is serious. The flu is, you've got a cold, you've got body aches, your whole body hurts. I had the flu one time, and just to move my finger hurt. I mean, it hurts so bad. You have high fever, and it's very, very, very contagious. So people catch it very easily. And if you are a child with asthma or with any kind of health problem, let's say you have, sickle cell trait or sickle cell, or you have, Crohn's or any kind of underlying condition, and you get the flu, you can easily end up in the hospital. All right. And that same goes for adults. So when kids get the flu, because they get exposed to a lot of stuff at school, when they bring it home, they're bringing it home to their grandparents who maybe have high blood pressure, diabetes, they might have heart disease. They're bringing it home to their parents who have to go work every day. And you cannot work when you have the flu. Yes, last week in our office, 3 of our nurses were out with the flu. We were down to 1 nurse in the whole office, and they had actually gotten their flu shots. And so that only lasted a couple of days. It didn't last as long as it normally does. But please when you go to get your COVID shot, if you can, get your flu shot at the same time. It's really important. I told both my boys that they can't come home from college unless they've had their flu shots, because I don't want them to give the flu to my mother and to their other grandparents. I'm not worried about it for me as much because I'm pretty healthy, but the elderly folks die of the flu. Every year we have people die of the flu. So it's a one-time shot, no side effects with it. You don't get the flu, and basically, and then the other thing that's really important all year round is hand washing. And you know how hard it is to get kids to wash their hands. So that's where you want to use the hand sanitizer. But you should always have hand sanitizer in your car. When you go to the store, you come back, get in the car, clean your hands. Always, because we touch stuff, we touch our face, we transmit it.
So I just had a quick question. I think for children that have asthma, why is it so important for them to get the flu shots?
Because if they get the flu, it will trigger their asthma and they will have a lot of trouble breathing. And they will probably end up in the emergency room or possibly admitted to the hospital. Because if they get an infection in their lungs, they get sick very quickly.
Thank you so much.
So that brings up the issue of, it's not just about getting vaccines. Kids need to get a checkup every year. Okay, every year. If you've got Medicaid or Peach Care or insurance, it covers that checkup. A lot of times I will have people like, I have friends or family that talk to me about stuff going on with their kids, and I'll ask them, I say, have you talked to their pediatrician about this? And they'll say, no, I haven't seen them since last year. And I'll say, go make an appointment. That's what they're there for. If you're worried your child is eating too much, not eating enough, is sleeping too much, too tired, if the grades aren't good, they seem depressed, they're not behaving, go talk to the pediatrician. They are trained to deal with all of that. Okay. And I'm a family practice doctor, so I do adults and children. That is what we're supposed to do, is we're supposed to help parents deal with all of these issues. I know you guys have teachers that are helping you at the school. The teachers do so much. Let the pediatricians and the family physicians help too. Turn to them to get their advice and get them to weigh in. And you could even take them if the school sends a note about the kid's behavior or something they're concerned about, take that with you and let the doctor see what's going on, because they are supposed to help. They're supposed to know you and talk to you about what you're worried about. There's going to come a time as your children get older when they may not have insurance anymore because they get older and they have to get it on their own. Until that time, take advantage of what you have. Take them to get their teeth cleaned every year. That's so important, or twice a year. Take them, use the benefits you have. Okay. Take them to the pediatrician, get them checked out. This is stuff that you have a right to. You are entitled to all of this. So there are a lot of shots that kids are supposed to get. And, when I was growing up, there was no debate about this. You just got your shots. Now everybody's worried about, oh, it's too many shots on this day, too many shots on that day. Listen, we've been giving this many shots for years, for decades to kids, and kids have turned out fine. And in developing countries, people feel really lucky to be able to get these shots. Okay. So, you don't need to worry about, is this too many shots on one day? Let the pediatrician or the family doctor or the nurse practitioner figure that stuff out. Go ahead and ask them questions. If you have questions, ask them. Let them explain to you why they need what they need. You should definitely ask and be informed and involved. But you really, if you can, you need to trust the process and trust that they know what they're doing, because their only goal is to protect your children.
So I have a quick question to ask you. I know that there's a lot of misinformation about certain immunizations causing autism in children. And I think that's a fear of a lot of people from different, ethnicities. Can you please elaborate on that?
Okay. So how many people know a child that has autism? Raise your hand if you know a child who has autism. Anybody? Right. So let me tell you why that is. So in the old days, we didn't know what autism was. We would think that a child was deaf when they were really just autistic. Okay. Or we would think a child was developmentally disabled, or they just didn't think right and they were autistic. So we're getting much better at diagnosing autism. So we've learned about it. In Afghanistan, nobody knew what autism was. They would just come up with some other explanation for why a child was the way they were. So it may seem like more and more kids are becoming autistic. What it is we're actually diagnosing it more. Okay. We're screening and we're trying to catch it early. Okay. There were 2 studies that showed a link between vaccines and autism. Both of those studies were found to be completely wrong. One of the doctors who did that study lost his license to practice. He's no longer allowed to practice medicine. Those two studies have caused so much damage, okay, because people have just taken that message and spread it, just like they spread other messages that aren't true. It's almost like gossip in a way, you know, but there is no link between vaccines and autism. What happens is sometimes you realize a child is autistic around their 2-year-old or 1-year-old birthday. And that's the time when they get that MMR vaccine. And so people think it's related, but there's never been any proof that says it's related. And if you look at most doctors, if you did a survey of doctors around the world, they all get their children vaccinated for everything. I mean, the majority of doctors do not hesitate because we know that it's safe.
And I also just wanted to list that the immunizations that you see, it's something that you can actually get from your doctor's office. So if you need to find out exactly where your child is in their immunizations, you know, usually doctors are good about notifying you if your child has missed an immunization. Definitely talk to them about it. And you can also get this full list. So this is not something that, you know, you have to have, but you can always get that from your doctor's office. And I think that's important. Always stay up to date on the immunizations.
You can also get them at the health department. You can get your vaccines there. I'd rather you go to your doctor's office because they're going to talk to you about a lot more. But if you can't get into the doctor's office or you're really behind, you can go to the health department to get these vaccines.
Absolutely. And really, doctors are a trusted source of information. So I feel like people sometimes are a little bit hesitant about talking to a doctor. And I think that any concern that you may have, whether it's about your child, you know, go to your doctor, sit down and talk to them and see what sort of advice they can give you. So I think that's really important to have that connection.
Yes. Do you mind if I address one of the questions in the chat?
Yes, please. Go right ahead.
So if somebody got the Johnson & Johnson shot, yes, they should get the bivalent booster.
Yes. Perfect. Okay, so we're going to move on to emergency care for children. And, you know, you probably know the importance of this. You know, one of the things I thought that was really important that sometimes people don't necessarily know is that when your child is having an emergency situation, you need to take them to a doctor or, you know, an emergency center. I find that people usually go to an adult center, like an adult emergency room, as opposed to going to like the children's hospital. And you can just talk about the importance of that because I just feel like they're, you know, well equipped and.
Right. Well, if your child is having an emergency at home, like they can't breathe or they've fallen and they've hit their head, you probably want to call 911 because they need to come and see what's going on and make sure your child is safe enough to be put in a car and taken somewhere, first of all. Okay. But if you think, okay, it's not like that kind of emergency, I can drive them somewhere. It's really good if you take them to one of the children's hospitals and the adult hospitals like DeKalb Medical Center, places like that, they aren't really set up to take care of kids the way. Now they'll stabilize and do stuff until they can get them to a pediatric hospital. But if you can get to a pediatric hospital, that's where you want to go. If it's really serious though, you should call 911, especially if you think that your child is not breathing, if your child, it looks like they're passing out, if they're bleeding badly, just call 911, you know, and they can come and they will always take you to a children's hospital.
Absolutely. And I just went ahead and listed the Children's Hospital in Eccleston. I believe that is the closest to us. Their phone number is here if you want to write that down. But I've had really good, you know, great experiences with them where, you know, if we've had a situation with any of our kids, the minute we go there, they see us immediately. So I think that has, you know, it's just a great place to go to if you need that assistance.
Somebody was asking about the flu shot under age 5. Absolutely. You can get the flu shot under age 5.
Perfect. So we're moving on to healthy eating.
So I think a lot of people on this call we're immigrants, right? We came from other countries. And so I want to say So the way you ate back home is probably much healthier than the way we eat here. Okay. So I'm just going to tell you, now when I was little, my mom always made Afghan food, and I really wanted American food because I thought American food was so cool. Like, she would never make like the canned Chef Boyardee stuff. Like, that probably isn't even around anymore, but I wanted that stuff so badly because I thought it was so cool because there were all these commercials on TV about it. Now I realize that stuff was, bad. So if you can get your kids to eat the food that you make at home and that you traditionally ate, you're going to be in so much of a better place than if you shift to the kind of diet we have in this country. Okay, because in this country, we do a lot of carbohydrates. So what do we give kids for breakfast? We give them cereal. Cereal is mostly sugar and like carbohydrates. You know, there isn't a lot of protein or fat. You know, so if you could try to stick to what you would have eaten in your own country, you're actually going to be better off. Because even if you just have bread with butter and jam, that's healthier than all the sugar that comes in cereal. Okay. I see a lot of kids who are overweight. And these kids would not have been overweight back in their home country. They're overweight here because everything that we get here is really big and it has a lot of sugar and calories in it. So, you know, back home, you would have probably eaten more fruit, you know, more vegetables, natural things. You want to try to do the same thing here. Your kids aren't going to want it. They're going to want like I remember my boys wanted those Takis or whatever it was. Those were disgusting, but that's what they would eat all the time. Like I would find it in their backpack, the empty containers. And I was like, what is this stuff? What's it even made out of? We don't even know, you know, but they love that stuff. And okay, that's fine. But then you need to try to get them when they're at home, when when they're away from you, you can't watch them that easily, right? When they're home, you need to have healthy food at home. Not the stuff they're going to beg you for, not the chips and the Coke, sodas, even Gatorade is not necessary. It's got so much sugar in it. If you could get them to just drink water, that would be better. Okay. Juice has a lot of sugar in it. Juice is better than Cokes, but they really just need to drink water if possible. The other thing that is really important is a lot of teenagers are drinking these energy drinks. Red Bull, I don't even know all the names. Those are really bad for you. They mess up your heart. They mess up your kidneys. A lot of adults are drinking them too because they want to be able to stay awake to go work their second job. You've got to be careful about that because it pushes your blood pressure up. A lot of young people who are exercising are doing, what is it called? These pre-workout drinks. Mm-hmm. Those are really bad. They give them extra caffeine and all the stuff so that they can work out harder. People need to stick with water. Water is what they need to drink. But the more you can keep healthy food in the house, the better. Because when they're not with you, they're going to eat the junk. They will. You can't stop them. But at least when they're at home, they should eat healthy food while they're at home. So when I was growing up, you know, we had a set bedtime, but that we had to be in bed and then had to get up and all that. But nowadays I see a lot of kids, even if you give them a bedtime, they go to bed and what do they have in the bed with them? Their phone, right? So let me tell you what I suggest, and your kids are going to hate me. You can tell them that I said this and they can just hate me so that they don't hate you. You can just make me the bad person. But when they go to bed, you should get their phone and they need to put it in a basket and leave it downstairs. Okay, because what happens is the kids and my boys, I had the same problem with my boys. And finally, my younger son was like, I can't fall asleep unless I'm on my phone. That's when I knew things were really, really bad. They need to put their phone downstairs, leave it with you. Plus, that gives you a chance to go through their phone and see what they're doing, okay, so that you can see what they're up to. You need to have all their passwords, all their passcodes for all their phones. If they won't give you the passcode, then you turn off the phone, okay, because that you have to find out what they're doing on those phones. But any lack of sleep really affects their grades. It affects their grades. It affects their temper, just like with us. If we don't get enough sleep, we can't function the next day at work, right? But as they become teenagers, what happens is, this is natural. They won't be able to fall asleep at like 10 or even 11. Their body shifts. They'll fall asleep at midnight, and then they want to sleep to like 9 or 10 the next morning. On the weekends, let them sleep in if they're, teenagers, because they've got to get that sleep. They're not going to get enough sleep during the week because they've got to get up early to get to school. But you'll notice they'll say, I can't fall asleep. I can't fall asleep. Let them stay up a little later, because they're just going to lie in bed and be miserable. Okay. Because that circadian rhythm shifts as they become older. Okay. And then sometimes they need to take naps. So if that's happening and they come home and they're a teenager, or they're like 15, 16, 17, they might need to take a nap during the day to catch up on that sleep that they're missing. But I would say anytime they're on a laptop, or even if they're on their phone, they need to be in the living room with you. Or if you're in the kitchen, they should be in an area where you can kind of look over their shoulder and see what they're watching. Okay. I mean, because you don't know, sometimes they're watching something normal and something crazy pops up in there. You need to know what they're watching. Okay. Because if they're in they may say, oh, I have to go do this. No, bring the computer back then. Do your homework here at the kitchen table. Okay. Where you can see what they're doing, if possible. I know sometimes it's not possible because you're working and things are hard, but if you can, try to do that. The other thing is, you can set limits on their phone. You can program their phone so that it turns off at a certain time, so that they can't get on certain apps. You may have to kind of look online to figure it out. But part of the problem is, as adults, we spend so much time on our phones and on our computer that our kids do the same thing. So if you come home and you immediately get on your phone and your computer, what do you expect your kids to do? So we have to be aware of that too. And I know in my family, we had a rule, no phones at the dinner table. Like you could use your phone to look up something if somebody asked a question about something, but it's hard. This is a problem that's affecting our whole society, not just kids. We're all on our devices way too much. So, and then at dinner, I used to basically, I would ask my kids, well, how was school today? And they'd be like, fine, fine, fine. They don't want to tell you anything. It's hard to get that information out of them. So then start talking about your day and see if that'll bring them out a little bit. If you start saying, what's your day like? But, and then the other, I don't know if it's the next slide where you talk about supervision, Suad, or is it this one?
I believe it's this one.
This one? Okay. So part of knowing what they do online is also know what they're doing when they're not with you. So I noticed that a lot of folks let their kids kind of run around and do stuff. And that would be great if we lived in a safe world, but we don't live in a safe world. Kids get abducted, they get taken. Kids, get hurt. They get hit by cars. They can, fall off their bicycle and get hurt. You've got to try to keep an eye on what they're doing. When I was little, the older sister had to watch the younger sister, had to watch the younger brother, all that. Sometimes that works, sometimes it doesn't. But in this society, we've got to watch our kids because there's a lot of hazards out there.
Yes, definitely. And even something as innocent as a kid playing a video game, it's really important to monitor that, because a lot of video games have these chat rooms that kids can actually go in and sort of like converse with who they think is another kid their age, but sometimes it could be an adult trying to lure the child in. So I think that's like just really, really important.
Yeah.
I also wanted to talk a little bit about like being able to spend one-on-one time with your child. If you just want to talk a little bit about that and how different it is in different cultures and their beliefs.
Right.
And that, yeah.
So, I grew up here in the United States and I'm very Americanized, and I look at how my parents raised me, and my father always talked to us a lot, especially about education and things. But my mother was very busy cooking and cleaning and doing all this stuff. And, there wasn't this focus on let's spend time alone together. But if you know, it's really important, especially in this culture, in this society, that you know what's going on with your kids and that they feel like they can tell you things. Because in my family growing up, if something bad happened to me, my parents would get mad at me. Like if I got lost and then they found me, they would yell at me. Like, why did you get lost? You know? So instead of like being happy that they found me, I mean, they were happy they found me, but then they would smack me because why did you get lost? You know? And what happens, I think, is there were times when bad things happened to me and I didn't tell my parents because I thought they would get mad at me, right? So there are a lot of bad things in this society that can happen to kids. You've got to have the kind of relationship with your kids where they feel like they can tell you anything, that you won't get mad. Anything. Because if they're scared that you're going to get mad, they won't tell you if somebody's bullying them, if someone has touched them inappropriately. You know, they've got to feel like they can come to you with their problems and that you won't get mad. All right. I mean, I would, if I fell and cut myself, my dad would yell at me, like, why were you doing that? I'm like, I wasn't doing anything crazy. I was just playing outside. Well, you shouldn't have done that. That was the culture I grew up in. Right. And so when I had a teacher in school who was being really mean to me, and I didn't tell my parents because I thought they would just get mad at me about it. And, you know, nothing bad happened or whatever, but it's really important that your kids feel like they can come to you with any kind of issues. And so you might need to talk to them about it and say, listen, if this happens, I'm not going to be mad at you. You have to tell me. You know, if you try drugs or you're thinking about trying drugs, you know, I want to talk to you about it. Let's talk about it. I know that's hard because none of us want that to happen, right? But it's hard to do. But if you can build a kind of relationship, and that means spending time with them. You know, even now when I go to my mom's house, she's always in the kitchen. She never comes to sit down until like late at night when she's done. And I was like, Mom, sit down, let's talk, you know, because that's just her custom and the way she was raised. But it's important. It's okay if the kitchen is dirty. Sit down and talk to your kids.
Absolutely. Thank you so much for mentioning that. I know we're getting a few questions here and there, and I wanted to just, I think there's somebody that asked, sort of going back to the healthy eating, where they were asking, you know, what are the essential vitamins that, you know, we need to give our kids to ensure that they're, you know, up to date and healthy.
So one of the things kids often are very low on is iron. So their iron levels can drop. So the doctor will check that. But the other thing they can be low on that doctors don't check is their vitamin D. D as in dog. And so I actually think it's a good idea for kids to take a multivitamin every day because most kids don't get enough vitamin D. But you have to be careful because the vitamins taste good and you have to put them somewhere high where they won't eat them all at once because that can actually be toxic, especially little kids will get into it. But to me, vitamin D is really important.
Absolutely. And also just going back to the emotional well-being of kids, you know, one of the things that I noted is making sure that kids get their physical activity, like their playtime if they're young, and how important that is, especially for them to be outside in nature and how good that is for them mentally, right?
Right. You know, I know ICS is really good about this, but if you can get them to do sports, that's great. So when I was growing up, my parents thought sports were a waste of time. Like you should just be studying all the time, right? But that's not true. Sports are really good for your brain and sports keep you out of trouble. So, you know, being on the soccer team, running track for boys and girls, if they're busy doing that stuff, they're going to be healthier, they'll be exercising, and they won't have time to get into trouble doing a lot of this other stuff that kids are doing today. So, and plus, you know, it's a good way to learn skills like how to get along with people, how to be on a team. So it's actually very important for the development of a kid. But even if they don't want to do sports, you going outside with them, having them ride their bikes, taking, you know, going for walks, hikes. I know you guys are really busy as parents, but trying to make time for that is really important because obesity is a big problem with kids today and adults.
Absolutely. Okay, I think this is great. So we are going to move right on and just talk a little bit about the upcoming event that we have. We obviously have our superhero theme, which has worked amazing for us, and any kid that does get vaccinated will get a little superhero gift bag. Anyone obviously that gets the COVID-19 vaccine will get the $100 incentives, but we will also be providing flu shots, information on mental health and resources, blood pressure screening. We're doing cholesterol and diabetes as well. So it's going to be at ICS on the 16th. So we have added the 2 QR codes. As you can see, you can always scan that on your phone if you want to do registration. But again, just like Cassidy had mentioned, one of the amazing things about CORE is that they're very, very friendly, and, you can walk up there and just, everybody's there to help you out, and they're able to provide interpretation as well, but it's just really quick. It's just in and out. And yeah, so they're going to be there as well, and we cannot wait to see all of you there. So we're going to move on to questions. So what we'll do is we are going to create 5 breakout rooms in different languages, and I would love for you guys to get into the breakout rooms. It doesn't have to be everybody. If everyone wants to stay in the main room, you can do that and ask questions, but anybody that does need interpretation, you can get into the breakout rooms with the interpreters. And I have one of my colleagues that's going to be helping me with that. So the screen will pop up and you just choose whichever language you would like. Bear with me 1 second. Let's see. So if you just scroll all the way at the bottom, we have Nepali, we have Somali, Burmese, Arabic, Farsi, Dari, and Pashto. So you can join any of those rooms with interpreters, and you can ask them any questions that you like, or if there's something that you need clarification on, you can go ahead and ask interpreters, and then they will come back to us and let us know. And in the meanwhile, I'm going to look at the chat and see if anybody else, I think somebody had a question about the flu shot, and they said if they have a child that is under 5, can they get the flu shot or not?
Absolutely.
Okay, very good. And you can take both of them at the same time. It is allowed. You can get the COVID-19 vaccine and the flu shot. So both of them will be offered at the event. If you need to get both of them, definitely do so. You'd be knocking out 2 birds. What is it? 2 birds with 1 stone? Yeah. Let me see if there's any other questions. Just scrolling through the chat box. If anybody wants to ask questions, please do so, or you can raise your hand and speak up. And please don't feel shy. Just know that this is a no judgment zone. Please feel comfortable. This is your opportunity to ask a doctor any questions that you have. Feel free to do so. We definitely want to give you the space to do that. And we will just go ahead and give them a few minutes.
And maybe again, maybe Suad, could you say one more time about how they can join those breakout rooms if they're needing translation? Our ICS translators have already gone into those breakout rooms, so that those translators are available to them.
Yes, absolutely. So I think we have a little pop-up screen that came up that says breakout rooms in progress. So if you want to scroll all the way down to the bottom, you will see the different languages. So we have Burmese, Somali, Nepali, and right next to it, you'll see join. It's just like a little blue icon. Just click join in whichever room you want to join. And that way you can ask the interpreter any question, and then the interpreter can come back into the main room and ask us. And yeah, we can go back and forth that way. We just want to give you guys enough time and make sure you all understand all about, like the vaccines and everything else.
Can I say something? Because
Yes.
some of them, I need to talk to them. Maybe they don't know how to click it. So, Nyamari Konglong, Jama, di Samaye ho, di ye, account lage, di Alma, a mele trailer. Join a breakout room, so a trailer. And I'll click low like that. အဲ့ဒါလေးကို click လုပ်ပြီးလို့ရှိရင်ပေါ်လာလိမ့်မယ် Burmese ဆိုပြီးတော့လေပြီးလို့ရှိရင်အဲ့ဒီညာဘက်မှာ join ဆိုတာလေးကို click ထပ်လုပ်ရမယ်ဟုတ်ပြီ good yay okay so အဲ့ဒါလေးကို join လုပ်ပြီးလို့ရှိရင်လာခဲ့ရုံပဲเนาะ thank you have to go to and then join Burmese ဆိုရင် yes လုပ်လိုက်
Joy Burmese ko itengah mahia himo. Ko itengah.
Maybe screen share and show them where that icon is. So what do you think?
Yes, I could try and do that.
That's all I can think to show.
Yeah, I have a little pop-up. So let me see how we can help them. I do see quite a bit of people have joined the Burmese and the Nepali. Is there anybody else that's having difficulties getting into the breakout room?
Hey, Swad. Hello.
Hi, Raha. How are you?
Good. I have a question for doctor.
Yes, go ahead, please.
Yeah, it's about flu shot. She did give us the age bracket. They only asked whether kids below 5 years can have COVID, flu shot. I wanted to know whether the one below 1 year too can get the flu shot below 1 year.
Yeah.
Okay.
It's a lower dose. It's not the same dose as the regular one, but yeah.
Yeah, then my second question is about autism, because I had someone mentioned it in the presentation. I've seen many parents, some are close to me, who have autistic kids, and they're really stressed. It's a serious issue. So I don't know whether there is a way they could create like support for those parents, because they need counseling, they have to know what is going on with their children. Yeah. Because some of them, they don't know what is going on. Some people it's the witchcraft, some people say vaccine, some people say American food, some people say the weather. So there is a lot of confusion there. I think parents need like counseling and education about that issue. Yeah, thank you.
You're welcome. That's a very good point. My nephew has autism and it's really hard. I mean, and some kids with autism really do better than others. Some have a really hard time, and there's so much variability between them. Like it, and you know, some people say it's maybe viral. Some people say maybe it's fungal. It's a fungal infection. There's so much we still don't know about it, but it's a devastating diagnosis for a lot of families. Sorry, my eyes are watering, but it's very, very hard. And we always want to find a reason for why things happen. It's natural, you know? And in my culture, a lot of times we blame the mom. I don't know if it's like that in other cultures, but they always say, oh, when you were pregnant, you did this, or you didn't do that, or whatever. But sometimes there isn't really an explanation. It's really hard. I agree that moms with autistic kids need more support. I agree. And the dads, the families in general.
Yeah. Thank you, doctor.
You're welcome. Thank you for bringing that up.
Can I announce one thing for my families? Okay, سوری میبخشین فامیلای محترم اگر شما نمیفهمین که در کدام روم داخل شوین در صفحه اول برین یک چارکنج یک علامه است داخل از امور کلیک کنین سرش داخلش برین باز اونجا میایه فارسی دری و پشتو داخل امور انتخاب کنین و داخل روم افغانا میشین در صفحه اول باشین Thank you so much.
I think we had somebody that spoke Dari, and they're going to be joining us in this main room. So I think they can just directly ask you a question. And I'll get back to the slides.
Hey, Swat, I think she found our Dari translator.
Oh, she did. Okay, very good. Perfect. Does anybody else in this room have any questions?
Hey, Ms. Todd, this is Inuka. Can you hear me?
Hi, Inuka. How are you? This is our amazing community partner. Hi. So
Thank
glad
you
you
so
could join
much
us.
for inviting me to this wonderful group once again. And just wanted to let you guys know that I am presenting in the Refugee Women's Network Wellness Group tomorrow. I hope you know that already. If you do not, then I'm letting everybody know about it. It's Ms. Temple Moore will give you more information how to register. It's at 11 tomorrow, 11 to 12:30. And another doctor, Dr. Suresh, is also presenting about autism in children. So I'll be covering asthma and diabetes, and she'll be covering autism. And I will jump in because my son, 15 years old, has autism, so I can talk to the audiences about my challenges as a parent with special needs children. And he's a celebrity. I'm very proud of him. So
He really is.
yeah. So
Thank you.
thank you. And I just talked to the Nepali translator who works in the ICS school that please help me get into the school, and I can bring the free asthma self-management program to any school. And ICS is one on my list, top on my list that I want to go there. So
Yes.
help me just.
I will actually, because if many of you don't know, Inuka also works with the DeKalb Board of Health, and one of the things that she does is talk about asthma, which I think is amazing. So I will definitely connect you to Charlotte, and you guys can talk about that in doing sessions. I think that's well needed. I mean, my son this summer was diagnosed with asthma because for the longest time we were like, what's going on? Is it severe allergies? Is it, this or that? But finally, knowing that it's asthma, it's like we knew what to do. But I think that's a resource that parents really need, especially now when a lot of kids are getting the flu. I mean, my son probably missed combined a good week of school just because, his asthma was really acting up and he had the flu. And yeah, so it's definitely challenging. And I know that sometimes too, when it gets really severe, they end up getting croup at night, which is kind of scary for someone that's new to this. So definitely.
I'm currently working in the DATE school, the DeKalb Agriculture Technology. And this is my phase 2 there. Actually, there's so many kids who have asthma in that school that I could not cover in phase 2. I need to do one more phase 3 with our higher grade students. So that is the pocket. There are certain pockets in DeKalb County that we need to target. So, and I know that Clarkston is also one of those areas where there's so many children. Most of them, their parents don't even know about it. They don't know about it. So when I start teaching them and tell them what are the symptoms and signs, and then they tell me, they raise their hand, oh, looks like I might have had it because I had those symptoms. So this is important information. So thank you for helping me.
Thank you so much. Thank you for being with us tonight. This is great. And I will definitely share the flyer for tomorrow's event. I believe it is in person. And I'll try and see if there's a way they can do both, maybe a hybrid for those that cannot attend in person to maybe do virtual, but that's something that I will definitely talk to Temple about, and we will share the flyer and hopefully we can get that posted on Classdojo.
I appreciate it. So today was a very long day. I'm going to take your leave. Thank you so much for inviting me, and you have a full rest of your evening. Thank you. Bye-bye.
Thank you so much.
You know, asthma is epidemic in Georgia because of all the pollen and the poor air quality, especially in the summer with all the smog and everything. You know, a lot of people think that their kids are just have a cough, but it's actually asthma. So she's right. If somebody doesn't talk to you about it and ask about it, you can think, oh, my kid just has a cold all the time or whatever, when they're really suffering from asthma.
Absolutely. So it looks like we are going to give maybe 2 more minutes for anyone that's in the breakout room, and they'll just get that little warning in a few minutes.
I have a question inside.
Yes, please go ahead. Hi.
Yeah, hi. My son have asthma. He is like almost 14. So he get 2 doses from Pfizer. So now did he want should to take flu shot or COVID shot?
So he needs both, but
Both together or
together. He can get them both together.
So it's okay if he taken together at same day.
Yes, it's okay if he takes them together, but if he wants to take them separately, I would do the flu shot first, because flu right now is more risky than COVID is right now.
Yeah, now
it's
my
so
daughter
bad
has a
right
flu
now.
is like
So,
three
yeah, but
days
you can do both. Yeah.
Yeah. Thank you so much.
You're welcome.
Great questions. Thank you. I think somebody had just put a question there, and I think Faven from CORE was able to answer it. And I think they asked, can 4-year-olds get the COVID test?
I think they meant the vaccine.
Yes, I think they were trying to say the vaccine. And if you already have done 3 COVID shot, can you do another? I think that was already answered. And
I think Faven answered, so you cannot get the COVID vaccine before age 5.
Yes.
Yeah. The other thing we should mention is anytime that the federal government is offering free COVID tests, every family should order them. You want to have a lot of tests at home that you can use to check, because sometimes you may think, oh, I'm just tired, or I just feel a little run down, but you do the test and it's positive. And it's important to know if you're positive, so that you don't go around spreading it to other people.
Yes.
It's so easy. You just fill out this easy form and they will send you, is it 4 tests or 8 tests? I can't remember how many they're sending out now, but it's not as accurate as the PCR test that you get done at like a testing site, but the home tests are still really helpful.
Absolutely. Yeah, I think that's really, really important. There's also another thing too, where we hear that people get tested. So I think when they immediately start getting symptoms, they rush in and get tested, and then it comes up negative. And then when they wait a number of days, they go back and it ends up being positive. What is the time period to actually wait from the time that you get the symptoms to when you get tested, just to make sure that the test is accurate?
So about 4 days if you're doing the PCR test.
Okay.
But the home test could take longer. That's why we always tell people when they call the office, okay, it's good that your home test was negative, but go do a PCR test. But it's hard to know, like from when you got the symptoms. Oh, I'm sorry. When you get the symptoms, the PCR should go ahead and be positive. I thought you meant when you got exposed. I apologize.
Yeah.
So, yeah, but sometimes it's still negative. You may need to get checked a couple of days later because it just varies, you know.
And tell me, are you getting a lot of cases right now on COVID and the flu? I mean, the flu, I feel like.
Yes. Flu, yes.
Flu,
yes.
you are. Okay.
COVID, not as much. But every time there's a holiday, Like after Thanksgiving, we will get a lot of positive COVID tests because everybody gets together and, but, you know, I think, but now, you know, people are getting together anyway. I think it's not like it was last year, but the flu is really bad right now.
Yeah. It really is.
I have to call my boys again and tell them to get their flu shot. I know they're not going to listen to me. I sent them the link to where they could get it on campus. I did everything I could do.
Exactly. So we are going ahead and we will be closing out the breakout room. So it looks like it'll be less than a minute. But yeah, I mean, I feel like that's really important. I know a lot of people who just don't think it's necessary to get the flu shots, but this year has really hit us hard. And it, you know, that's one of the things that we will be doing at the ICS event is to definitely have make sure that just not me, but all my kids get the flu shot because we can't go through what we went through. I mean, I was sick in bed for like 2-3 days, and that was a little. I haven't been sick
really
like
hard.
Yeah, absolutely. I think somebody also had put in the chat, where can they get information about next week's event, if I'm not mistaken? And I just wanted to mention that the school will be providing you guys with a copy of it, of the actual flyer, and also, oh, tomorrow's event. I apologize. Sorry, we just got another chat. What event is this for tomorrow? Is this the one for Luam? If you want to, do you want to speak up? And are you talking about the event with Refugee Women's Network on autism awareness and asthma? Okay, perfect, for autism. Yes, what I'll do is I'll go ahead and share the flyer once I'm done with this webinar. I will send it to Charlotte, and I think they can go ahead and post that on Class Dojo. Maybe by tomorrow you should be able to get that information.
Yep. Yes.
Thank you.
We'll do that. Definitely for the one for tomorrow, we'll put it there. And then for the health fair on Wednesday, it will be on Class Dojo several more times. But
Yes.
then we'll actually also put a paper copy in the Friday folders. So
Absolutely. And please come. It's such a fun event. We'll have our superhero volunteers dressed up in superhero costumes, and the kids will get the goodie bags. But it's really a great opportunity to be able to get like the flu shots and the vaccines. And then if you need to get screening as well, I think it's really important. Definitely come out and get your blood pressure and your diabetes and cholesterol screening as well.
That's really wonderful. I mean, those are some great services.
Yeah, it really is.
Because you can't know that you need to do something different unless you know that there's a problem, you know, and blood pressure is so important to check because it doesn't give you any signs that it's high. It can be high for many years and you have no idea. But it can do so much damage and so much harm during that time. So that's really important.
Absolutely. Yeah, because I think even today you hear really young people getting heart attacks or strokes, and that's really scary, you know?
Yeah. Yeah.
And, you know, if you guys want to also just put in the chat, you know, we want to be able to provide these webinars to schools. I think it's great to just have these sort of like educational sessions, but also being linked up with a doctor where you can just ask questions. So if you have any specific topics that you'd like for us to address, or even services that you would want for us to provide at any of these health events, please let us know, because, you know, we really value your input. But if anybody else has any other questions, please feel free to come forward.
I think one person is raising their hand and she has a question. Shakila?
Yes, please go ahead.
Yeah, I have, it's a question of a family. They are asking me. So, but she wants to ask Miss Dr. Hoge if she knows Terry.
Yes.
Because it's about her daughter. So she wants to talk in person, if you don't mind.
No, that's no problem. If that's okay.
Else.
Yeah.
Okay. میبخشین دکتر صاحب یک خانم است اینجا میخوای دختره که 6 ساله است در ICS میباشه اما تقریبا 1 ماه بیشتر میشه گریه میکنه حتی 4 ساعت 5 ساعت 6 ساعت خسته هیچ نمیشه پرسان میکنیم دلیلش که چی است مشکلت، در مکتب مشکل داری، سر هر چیز بهانه گیری میکنه، اما تا هنوز هیچ دلیل قناعت بخش پیدا کرده نتونسته برش و این بسیار فامیلش متاثر ساخته. میخوای از شما یک چیزی نظری بخوایم.
ایره تنها کت کسی میمانن؟ کت یک بیگانه یا یک کسی که خود مادر و پدرش نباشه؟
نه، کت پدر مادر، کت چی است؟ گرندفادر گرندمادر.
خب این مهم است. این بسیار یک چیز جدی است. باید بفهمیم که چرا این بیچاره گریان میکنه و چرا نمیگه. البته میترسه که چرا نمیگه که چی آزارش داده یا مگن باید یک کس یگان دفعه اگه بگویی که اینه اگه گفتی ما برات یک تحفه میتم یا میریم اینجا شیریخ میخوریم، یگان دفعه او تاثیر داره سر یک اشتک. مگن این بیچارگک به خیالم ترسیده که نمیگه که چرا.
سلام علیکم دکتر صاحب.
سلام علیکم.
نام من فهیمه هستم، دخترک من هستم.
بله بیچارگک.
هر آن چیزی را کوشش کردم برش، گفتم اینجا میبرم، هر چیزی بگه برش میگیرم، اما یکی ما تقریبا میشه که ناق گریان میکنه. یک بار میگه من مکتب خوش دارم، این میره، باز چند روز بعدش میگه من مکتب نمیرم، درس یاد میده. اول من فکر میکردم یمکن در مکتبش کدام مشکل است، یا کدام تا اذیتش کرده ایره، یا کدام در اون مکتب همیشه مسته. باز دلم خواهد طرفا جمع بود، بازم پرسان کردم رفیقایت کیسته؟ بله معلمش هم گپ زدم، میگه بسیار خوش است، میگه بهترین شاگرد است، میگه از بین شاگردا آیا جانم زیاد دوست دارم، کلگی دوست داریش. باز می خانه بیایه هیچ دلچسپی نداره در مکتب زیادتر وقتش.
این چی وقت سال اولش است این مکتب یا؟
بله یک سال پورا کرد شکلا. شما
چی وقت امریکا آمدن؟
تقریبا 12
نه خیلی تانوز یک سال شده که ما امریکا حساب آمدیم.
یک سال شده که آمدن؟ بله خب من نمره اگه من چطور بگم که نمره تلفنتان اگه بتین که ما شویم نمیفهم ما برای چی میگم سوال is there a way that we could kind of offline somehow get the contact. شکیلا جان شما میتونین نمره تلفن از این خانم دارین؟
بله دارم.
کتما باز با تماس گرفته میتونین؟
بله میشه
بخیر. خب بسیار خوب. ما باز یک شاره میکنیم بخیر، یک چیز
بسیار تشکر یک جهان.
Yes, so what we can do is when the session ends, we will just go ahead and stop the recording. And then, yeah, you can definitely share information or do that privately. Definitely. Okay. Would you like to share maybe the question or if you feel comfortable, or we can move on?
I think the issue relates to emotional well-being and trying to get it. And this happens a lot. Like I know with my older son, he was very unhappy in high school, and I didn't even know it because he didn't tell me. He told me later, and I felt really bad about it later because I thought he was just being quiet or whatever. And it just goes to you gotta ask questions. You've got to try to find out what's going on, and it gets really hard as they get older, especially because they can be so moody, which is part of the hormones that get released and stuff. But it's just very important to have that open communication with your child at whatever age. But it sounds like this family is doing everything right. They're doing everything they can do to find out what's going on with this young person. So that's good.
Absolutely.
Yeah.
Yeah, no, this is great. I mean, this is what the session is about, and it's about trying to also connect people to resources. So I would like to go ahead and let me see. Does anybody have any other questions? I don't want to leave if anybody wants to ask a question or if we can address something.
There was one comment I wanted to make that we didn't really touch on. So, you know, what I have seen with a lot of Afghan families and my family, my parents, their generation, is they had really large families. Namakhada, mashallah, they had a lot of kids. And here in the United States, it's really hard to do that because it's hard because both parents a lot of times have to work and it's just difficult. You don't have your relatives around. You don't have your family to watch out for your kids the way it was in Afghanistan. I remember when I had my first son and I had to go back to work. My mother felt so sorry for me. She was like, you know, she said, when I was in Afghanistan and I had all my aunts and cousins and everybody was taking care of you. I didn't do anything. I didn't even see you. You were like, they had you and I barely saw you. And now here you are, you have to do it. And I said, yeah, that's what life is like here. You know, it's kind of on the parents, right? And so one of the things you can do that actually helps your kids is if you wait a couple of years between your children. So we've seen that if you wait 2 years at least between having another child, it's very good for the older child and the younger child. So to try to space your children out, like instead of having 6 kids, you maybe have 4, but you've got 2 years between each one, can really help your body as a woman, but also help your children get the attention and the care that they need. And that's something that here, if you're interested in that, you should talk to your doctor about, or even the pediatrician about what can I do to kind of space my children out a little bit so that I can pay attention to this one before I have another one, kind of. That's something that, you know, you should feel like you can talk to them about and ask about, because we have those kind of services here, if that's what you're interested in. So I just wanted to mention that.
Perfect. Thank you so much. It looks like we are actually right on time. You know, I really want to just thank everyone for being here and especially Dr. Nazari for being here. This has just been such a great webinar. And if anybody has any questions that we have not, or maybe just later on might have some questions, definitely feel free to email us. You can email it to prc@gsu.edu. If you have suggestions on any future webinars that you would like for us to conduct, please do so as well. But I really want to thank you all for your time. And once again, thank you so much and just have a great evening. Thank you. Bye, everyone.
Everyone.
Thank you. Thank you, everyone. Good